The Uganda Demographic Health Survey report of 2016 shows that Uganda made strides in reducing mortality indicators over the last 10 to 15 years. This was made public during a ministerial statement to Parliament on the country's state of health service delivery.
The under 5 mortality rate showed significant decline from 90 per 1,000 live births in 2011 to 64 per 1,000 live births in 2016.
However, life expectancy might have improved from 45 in 2003 to 63 years in 2015, but some improvements in the health sector are still essential. This comes in the wake of reports that 39 districts across the country have no hospital at all.
The health system structure ranges from the community level, where we have the village health teams, to tertiary level, where we have the national referral and the specialized hospitals. The majority of service providers from both the public and the private sector focus on delivery of primary health care under the district local governments.
This could be the reason why government is in the process of acquiring a loan of 10 million euros for health improvement in Karamoja.
And this will include upgrading health center 2s to 3s and constructing health center 3s where they do not exist.
Why Karamoja? Is it that the health service seekers from other parts of the country have no ordeals to narrate? This was also partly answered in the ministerial statement.
A general hospital should serve a population of 500,000. A health center 4 should serve 100,000 people. A health center 3 should serve 20,000 people. And a health center 2 serves 5,000 people.
The statement, however, drew mixed reactions, with some MPs welcoming it, as others poked some holes.
Issues to do with the vaccines. Madam Speaker, there's been an outbreak of measles all over the country, and in West Nile it is worse. We've been receiving calls every day.
I would like to thank the minister, really, for this statement. We have been waiting for this kind of statement. Madam Minister, we shall work with you to support the Ministry of Health. We see statements being made here to provide money for other sectors, for foreign investors. When money is needed here, we are going to be with you.
So I want to, with your consent, to ask the Committee on Health to draft a motion with resolutions. Then we shall debate and agree one by one, because this one we can't adopt because it's not saying anything.
As the Health Committee of Parliament prepares a debate on the statement in the next 2 weeks, legislators from mountainous and island districts express reservations.
When you go to the mountains, the upper sides of the mountains, the hills, some of them do not have the facilities. We have to move a bit of longer distances. She talked about the ambulances, the referrals, but times for such aspect, let me say for mountainous and the island districts, we need special planning for them. At least we can have in those mountains the first points of contact.
Uganda's health sector is mandated to provide health services to all people in the country through preventive, curative, palliative and rehabilitative health services at all levels. How acceleration of movement towards universal health coverage with essential health services will be promoted awaits a parliamentary debate on the ministerial statement. Henry Okurut, UBC.